Hi everyone, it's Victoria Field, co-host of Metabolic Health Summit, and I'm so excited to introduce today's guest to you. We are going to be interviewing Dr. Westman, who is an incredible source of knowledge and light in this metabolic therapies and ketogenic diet space. He's an associate professor at Duke University. He's board certified in obesity medicine and internal medicine. And he's also the founder of the Duke Lifestyle Medicine Clinic since 2006 that's been around. And he's really dedicated his life to helping people with a variety of issues, whether it be metabolic syndrome, obesity, type 1, type 2 diabetes. And he's done so using nutrition and lifestyle, which is pretty incredible. For the last 20 years, he's actually been doing this, and he's also been simultaneously involved in clinical research and the author of several books that you're probably familiar with as well. So really excited to bring him in today because he's really leading, the force when it comes to this movement around metabolic therapies. And let's see if he's watching right now so we can go ahead and add him in. Dr. Westman, if you're on, go ahead and request to join, because unfortunately, it looks like I can't add you in here. Hi, Kareem. Thank you for watching. I so appreciate everybody who hops in here. Our goal at Metabolic Health Summit is to really drive the education around metabolic therapies and the ketogenic diet and the science behind it forward, because there are so many incredible clinicians, scientists, people in this space that are doing such important work. But if we're not talking about it, if we're not collaborating, that can make it really challenging to help educate the public. So that's really our mission at Metabolic Health Initiative and ultimately Metabolic Health Summit as well. So let's see if Dr. Westman is on here. I don't see him just yet. If Dr. Westman, if you're on here, go ahead and just say hello. Excuse me, I'm getting over a little bit of a cold, and I'm going to go ahead and invite you in. We've got some really exciting news today for those of you who have been watching on our Facebook and Instagram pages. We just announced our entertainment for our MHS gala dinner, and I could not be more excited. It's going to be a really incredible evening, one that supports the Charlie Foundation and Max Love Project. And the wildly popular comedian JP Sears is going to be performing stand-up that night. And if you've not seen his latest video, go ahead and Google him. Check out his YouTube. He made a pretty funny video all about keto. So we're excited to bring him on over to MHS. Dr. Westman, if you're in the room, and if you're in the room in general, those who are watching, say hello so I know who's on board here. For some reason, I'm not able to add in guests, but if you're in the room, Dr. Westman, go ahead and jump into the mix and we can kick off this live. Let's see if I can add him in. Does everybody here see me okay? I'm hoping. Let's go ahead and check over here. Excuse me, my cold is not quitting. Thank you for the thumbs up. I'm not sure who that was, but thank you. Let's see here. All right, so Dr. Westman, if you're on, go ahead and shoot me a little message. Go ahead and request to be added. I know Dr. Westman is there he is. Okay, let's see if I can add you into the room here, Dr. Westman. If not, you might want to request to be added, because I unfortunately am not able to add you in for some reason. So if you want to just shoot us a request, you'll see, perfect, there we go. And I know Dr. Westman is when it comes to social media. So I'm really looking forward to this conversation and introducing you to such a special physician in the space. Hi, Dr. Westman, how are you?
Great, how are you doing?
I'm doing good, long time no see.
No, I can't wait till the next meeting.
We're so excited to have you. I mean, you've really been there since the beginning. The Conference on Nutritional Ketosis, Metabolic Therapeutics, and we've invited you back to speak year to year because you just are such an incredible force to be reckoned with in the space. Metabolic therapies, the ketogenic diet, what you've done on the science side as a physician, as well as the education, is just really incredible. And we couldn't thank you, and we can't thank you enough for being a part of our conference.
Well, you're too kind. It's been exciting to watch everything grow. And Metabolic Health Summit is the place to go to learn about the new research on the keto diet. So I'm excited to be involved. Thank you.
Oh, we appreciate that a ton. Well, you've really shared some incredible information over the years, but I kind of want to take it back because this is something that you've been doing for 20 plus years at this point, using nutrition and lifestyle as an intervention when it comes to a variety of metabolic conditions that often we look at as maybe, drugs might be the answer, but you've found something very different and pretty profound. And I would like you to take it back to how this started for you, where this came from, and really your journey since then.
Well, sure. Like most doctors, I had very little training in nutrition. My training was in internal medicine. And if you would, think of any discipline that would want to know about nutrition, it would be internal medicine. I mean, we deal with organs as they fail.
Right.
If kidney fails, the heart fails, the pancreas fails, lungs fail, that's internal medicine. But the only training in nutrition I got was in the intensive care unit and, looking at nutrition when people couldn't eat or, IV nutrition. So going to the outpatient setting, I guess it was kind of good that I didn't know much because I followed two of my patients who did the Atkins diet. I followed them. They were in my clinic and I asked them what they were doing. And, when I finally read about it, I said, don't do that.
Right.
And because everyone said, don't do that.
Right.
I remember he said, well, what's wrong with the diet? What's your issue? And I said, the cholesterol. You're eating more fat, your cholesterol is going to go up, and it's going to be bad. And he kind of looked at me and he said, well, why don't you check it? Duh.
Wow. Good patient.
Yeah, well, fortunately, I wasn't so overtrained to say no, and I'm afraid a lot of doctors won't even check it. So 2 in a row, people doing this high-fat Atkins diet had improvements in their cholesterol, any way you look at it. The total, the LDL, the triglyceride, the HDL. And so that issue as a barrier was gone. And so then I started wondering, gosh, if it's this easy, I mean, these 2 patients of mine lost 50 pounds on their own.
Wow.
They didn't need me. They didn't need any specialist or anything. They just read a book. So I thought, if this is safe, how cool is this? This would be really important. So I did what every young nutrition or young researcher would do. I wrote Dr. Atkins a letter.
Wow.
Wouldn't you?
Of course. The first thing that popped into my mind.
Yeah. Looking back, nobody had the same idea. But anyway.
Right. That's pretty impressive.
Being a doctor, an MD, and he's an MD, and I had my father was an MD who had a practice in a university and learned a lot through the years. I thought, why not consult or ask someone who had been doing it? And it was Dr. Atkins who called and said, why don't you come visit my clinic and see what we do?
Wow.
And even to this 20 years later, most doctors have to come visit the clinic of someone doing this in order to get over all of the hurdles. You tell them to eat fat. You tell them not to worry about salt. You tell them,
What?
So,
it's like the whole world's flipped upside down.
It is. And some people are open to that. Some aren't. I was gravitating towards something that really worked. And then Dr. Will Yancey and I really kind of set up a program where we would look at the safety of it. So it was clear, I saw 2 patients who did it. It was clear that it worked. But there still was this nagging issue of, is it safe? And, I think it's been pretty well, nails in the coffin that it's safe, after 20 years of research in the world, across different genetics, and it's okay not to eat sugar, which is really kind of the bottom line,
Absolutely.
And because digested the sugar, all we really do is tell people not to have sugar intake that raises the sugar and the insulin and all that. So, and yeah, I think we help to kind of give legitimacy to an approach that had been out there but was thought of as a rogue approach, although most medical weight loss doctors used some sort of carbohydrate restriction in their practice because it's so effective.
Yeah.
And obesity medicine doctors, I'm the past president of the Obesity Medicine Association. We have to have programs that work or people won't come back. I mean, it's a return volume business.
Right.
So people come every, and so if you have a program that doesn't work, people don't come back.
Right.
So I was kind of shocked that all of the programs I learned about in the world weren't being used in the medicine world. No one used the DASH diet, even though it was kind of the MH darling diet. Nobody used the low-fat diet. If they did, they used orlistat, the drug, at the same time. So Dr. Yancey then continued studies funded by the VA, Veterans Affairs Administration, and the diet is as good as a diet and a drug.
Yeah.
So the low-carb diet for diabetes and for obesity is as good as low-fat diets with orlistat drugs. So, I'm really kind of, disappointed and surprised that it hasn't caught on today, but at least we can do research now. At least there can be conferences like Metabolic Health Summit, and it's exciting to see now that you can do research. We're learning so much about the state of nutritional ketosis beyond the weight loss and the obesity treatment and diabetes. And so I find it just, I feel like I'm just getting started because now I actually can study this approach.
Yeah, absolutely. I mean, I think it's an exciting time to see the momentum build. And just even in the last 4 or 5 years, from the first time you and I met to where we are now, I think things are starting to really gain some momentum. And I think it's too because we're talking a lot more about the science that extends, like you mentioned, beyond just weight loss, but into cancer. It's been around for 100 years in epilepsy. So that's obviously part of the conversation. But even in that category, I think we need to do an even better job specifically with adult epileptic patients too that might not know about it. So it's an exciting time, and you've certainly been at the forefront of pushing this along. What was that like for you as a physician, really experiencing your patients going through this and sort of turning a lot of things that you might have learned through med school on its head? What was that like for you? And I will say, I think it takes a lot of courage and a certain kind of person to be able to continue to pursue something like this that is so different, so opposite end of the spectrum to what, say the government food guidelines and whatnot suggest. What was that like, kind of going against the grain, if you will?
Yeah. Can we use a different term?
I know, it's terrible.
The grain on this one. Right. But I guess I was always clinically minded, so that the outcome was more important to me than the mechanism. And so it was curious when I would present research that clearly worked, and people would ask, well, how does it work? Well, I don't know. And then, of course, NIH in the mandate says you have to mechanisms, so NIH isn't going to be interested because I'm not telling people what the mechanism is, and I'm not even worried about that. If it has 5 mechanisms, great, I'm using them all.
Right. All 5.
The research, pragmatic research, is not really well appreciated among the hardcore mechanistic scientists, and so at first it was just kind of a curiosity. Now I'm surprised at it, although I understand why there's not a whole lot of research if you're interested in mechanisms. But clinically, I'm always, we do what we do because people get better. Right. And so I was a clinical researcher, I mean, I still am, but I had a clinical base at first. Mm-hmm. So I, as opposed to some people who become researchers first. And then, if it has clinical relevance, great. My research had to have clinical relevance. Now when I'm using this in the clinic, it's just so rewarding to see people get better. I do have to say it's just kind of disappointing when people are not successful for various reasons. The reason, the pushback from doctors is going away. At least it's much less now, at least in my area. I don't hear that doctors are telling people not to do it. So basically, we're up against now family members who don't know any better, or the competition where, you know, I just couldn't not have that cookie, you know.
Right,
Well,
right.
keto cookies and keto this, keto, or fat bombs, and have you made chaffles yet? You know, they're just fantastic.
I love that, Dr. Westman. You just said shuffles. That's amazing. It's true, though. There's so many options now, right? It makes it easy.
So I guess it's a mixed bag of emotions. Being propelled by the clinical successes is really what keeps me in the game. And yeah, I've also learned, I think, that, like, through Dr. Atkins' experience, where he tried to do it all. You know, he tried to be the doctor, the politician, the public policy. I'm staying in my lane. You know, I'm a clinical researcher. Now we have other people hitting the public policy. We have other people doing the mechanistic research. I mean, so it's a big team effort now. And I guess I've learned that I can be most effective by just here's what I see, you know, and here's people are listening now, which is fantastic. I've never been asked to teach so much in so many places, and yet I'm still anchored in my clinic at Duke, 4.5 days a week. So
Wow.
That's still what keeps me going.
Yeah, I don't know how you do it all, just doing what you do in your clinic and just in educating the public. I think it makes such a difference in you know, being able to speak about your work over the last 20 years, even at a time when it wasn't widely sort of the accepted, you know, nutrition is a part of, you know, the process and care wasn't really an accepted thing. I think that says a lot about you, and also writing about it too. I mean, Keto Clarity, you know, Cholesterol Clarity, these books came out at a time when people really weren't talking about keto. And so I think that's made a huge difference. And you have experienced such great success. I think I saw some pretty cool numbers. I mean, over 4,000 patients seen, and 98% of the patients that have been affected by type 2 diabetes, you've been able to help them get off insulin. That's amazing. And this is through nutrition and lifestyle, which says a lot. And I'm just so excited for you to share more about your important work at Metabolic Health Summit 2020. And it's much like what you're talking about, how there's a variety of people. We're all sort of working together, trying to do our part. That's what we're really passionate about at MHS. I think there's so much to be said for collaboration in this space and really moving it forward much faster, right? So thank you for that. And last year, you had a really interesting topic that you covered, which was difficult cases from a keto clinic, which I thought was amazing. And we actually have that up online. If you've not seen that presentation, definitely watch it. It's on metabolichealthsummit.com. But next year, you're going to be discussing lab testing on keto and a new keto normal. And I love this topic because it's something that I think needs so much clarity, and so much of lab testing currently is based around standards that just don't fit with somebody maybe on a ketogenic lifestyle, and really hard to make it fit within that box. So if you want to explain a little bit more about this topic without giving it all away, because obviously you're going to take a deep dive at MHS, but yeah, if you want to explain.
Well, I can't give it all away because I'm not done writing the slides.
There's that too, right? Yeah.
Today, the most common questions I get are, again, I'm coming from the clinical scenario, clinical situation. And so I'm going to bring the questions that people have about lab tests that I get every day. So I'll be speaking toward the clinicians who are using this, maybe even researchers who are wondering where to study in terms of the metabolic changes. And one of the big signals, of course, is the cholesterol metabolism. You know, it can change in such a favorable way for just about everyone. But then there are subsets of folks where it's not so favorable in the old way of looking at it. And so I'm going to take people through where that came from and how to look at the lab tests. So even a consumer who's got a bad lab test might benefit from coming to listen to the talk or watching the talk. So I'm trying to make it, practical to a patient going to the doctor with an abnormal test. What do you do with it? And then also maybe it would provide research direction for someone who's trying to figure out what to study within the keto diet world. So, you know, cholesterol metabolism is big. Ketone metabolism, you know, it's abnormal to have an elevated, no, it's abnormal to have ketones in the blood if you're a carb eater, for example, and yet normal if you don't eat carbs. So that's going to be the theme. What's normal? What is the normal range if you don't eat carbs? It's almost like what's normal when you're on the moon. You know, things are different.
Right.
And it may not be normal compared to carb eaters, but is it really pathologic? Is it really risky or harmful? And just trying to, because I get people panicked about labs. I mean, they'll fly to me from all around the country.
Wow.
Because there's some panic. A number on a blood test, you know. Now, if it was sodium and it was 2 times normal, that would be really bad, you know. So there's some tests you want to really worry about, but then there are other ones where it's not so much of an urgent threat, and yet doctors don't know how to well, in fact, they use that sort of panic and threat and worry and fear to get people to take drugs that they may not need, which is unfortunate. So anyway, it's been on my mind a while, and I think it's a common concern of people even starting a diet change. What if my lab test does this or that? So yeah, the new keto normal is kind of the theme of what I'll be talking about.
I love that. I wish that talk was around years ago when I started. I was a hyper responder, if you will. And I was certain at one point that my heart was going to explode because my cholesterol was all over the place. And I actually did have a couple of physicians tell me that I needed to get on a statin. And it's going to be such a valuable perspective that you bring, you know, the 20 plus years of experience you've actually had in testing markers with patients and really putting to rest some significant concerns that people might have around that and sort of, you know, shaking it up a little bit. I think it's going to be a great presentation. I know it's a topic that I find fascinating because, you know, it's a challenge. I hear, you know, I've been involved in some research with a nonprofit Epigenics Foundation, and many of the patients we worked with would experience these levels way outside of what's normal. And, you know, would have their physicians say, well, it looks like you need to get off that ketogenic diet. When all of these other things, their C-reactive protein, their, you know, overall mood, their weight, everything was great. So I'm so excited for you to speak on this topic.
I've gone full circle. If you go back to Yancey Westman 2004, one of our first papers, we actually dropped someone out of the study because the cholesterol went up too high.
Oh no.
So we had in our criteria, the cholesterol went up that high, we'd take him out, and we did. But now I said, don't worry about it.
Throw that out of the criteria. Let's keep going.
Spoiler alert, I'm going to say don't worry about it.
Right. Right.
Unless certain situations, I think, still merit consideration. But
absolutely,
it is a metabolism, isn't it?
Yeah, it's a very interesting topic and something that I think is a big part of the discussion in the keto space. And you've really done a great job at just laying down some initial foundation through Cholesterol Clarity as well as Keto Clarity. If people haven't read that book, definitely take a look. It's alongside Jimmy Moore, and both of them are. And it's just you provide such a great resource to the community. And what's next for you?
Well,
big question.
This year, my company, Adapt Your Life, right. It's an education and a product company, has launched a couple new products, new bars, but we've also done now, we'll be doing 9 weekend events on Saturdays. We've gone around the country, and from 150 to 250 people come out on a Saturday, and the idea is so that they don't have to travel to the Keto Con, the Keto Fest, the Keto this, the Keto that. We come to them, and it's been really exciting to see when I'll say, is anyone doing this, keto diet? And boom, all the hands go up, and it's really inspiring to hear the stories. And again, these people didn't need me; they did it on their own, and the stories are pretty amazing. The saying is, it's so unbelievable, people don't believe it. Probably the highlight was this little guy, I think he was about 10 years old, and after lunch, it's an all-day affair. We have lectures and have lunch, and then people give testimonials. His mom was actually talking about him because he had lost 80 pounds, wow. Old, and I finally looked at him and I said, "Are you Truman?" And, he goes, the story was just heartbreaking, heart-wrenching, riveting, and then he finally gets up and he grabs the mic and he says, "Keto is good." Oh. And then he sits down.
And then he drops the mic, right?
Yeah.
Oh, that's awesome.
So, yeah, it's pretty fun. So we're going to continue to do these face-to-face, weekend events, and we've actually just planned the first Dr. Westman Keto Retreat, and that's going to come up in January. Actually, we get our stuff together, it'll be the MLK weekend in January. Oh, wow. That's the plan. And so people
Very
can
cool.
meet.
Where's this going to be?
In North Carolina. There's a brand new hotel built by a keto zealotous owner.
Wow.
To get things started. I'm inviting all the North Carolina, or many of the North Carolina experts. Christy Sullivan, who lives in Pinehurst, does Cooking Keto with Christy. Casey Durango does Go Keto with Casey. These are internet, Facebook presences, YouTube, and books and things. And then Amy Berger, who wrote the Alzheimer's Antidote, lives in North Carolina now. And then Jackie Eberstein, who worked with Dr. Atkins. We're all going to be there in one place for the weekend. And it's going to be a lot of fun.
That's awesome. I love how involved you are in educating the public and creating experiences around it. I mean, that's what we're all about at Metabolic Health Summit. And I think that, there's so many great things going on in the keto community right now. And like I said before, collaboration and how we can support each other and getting the message out and doing it in a way that's scientifically backed, I think is so important as well. So I am very excited to hear what you've got in store. I can't wait for your talk, and we can't wait to have you back at Metabolic Health Summit 2020. And yeah, just thank you for being such an important part of this space and moving things forward. Thank you for all you've done, Angela. When people ask me what conference to go to, if there are any interest in research or clinical application, I say Metabolic Health Summit. I mean, that's the one. We appreciate that. Thank you so much. Well, I know you're very busy. I'll let you get back to work. Everybody, thank you so much for watching. And make sure you come on over to Metabolic Health Summit. Early bird tickets are only available to the end of the month. And then that's it. And we will see you soon in January. Great. All right. Thank you. Thanks. Talk to you soon. Bye.